Hello, everyone. Thank you for joining us today for the continuation of our Harm Reduction 101 series. The topic of today's event is tobacco harm reduction and its role in the larger tobacco control and harm reduction landscapes. My name is Chelsea Boyd, and I'm a fellow at the R Street Institute's Integrated Harm Reduction Policy Area, and I'm moderating the panel today. Before we begin, I want to take a moment to share R Street's approach to integrated harm reduction. Today, most harm reduction programs still focus on the risks associated with illegal drug use, drug policies, and drug laws. But because the ultimate goal of harm reduction is to provide practical, non-judgmental care tailored to individual circumstances and goals, the approach has far broader public health utility. When we talk about integrated harm reduction, we envision a reality where all harm reduction strategies are embraced and promoted. We believe that if you support harm reduction for one risky behavior, you should support it for all risky behaviors. An integrated approach to harm reduction acknowledges the overlaps between historically siloed issues, including comorbidities among populations served, the goal of reducing health disparities, and a commitment to providing a practical public health solution that accepts and supports individual autonomy. For tobacco users, a harm reduction approach helps people who use tobacco products transition to less harmful products or abstinence based on their individual goals and desires. Tobacco harm reduction hinges on the recognition that tobacco products exist on a continuum of risk, with combustible tobacco products representing the highest risk to health and products like e-cigarettes, nicotine pouches, heat-not-burn devices, and snus falling lower on the continuum. In today's discussion, to ground today's discussion, I want to provide a little overview of the policy discussions happening around reduced risk products. At the federal level, the Food and Drug Administration is reviewing pre-market tobacco product applications to determine which products are allowed to stay on the market. Recent legislation also brings products that use synthetic nicotine under the FDA's purview. In the states, legislation banning flavored e-cigarettes, limiting nicotine concentrations, and creating tobacco tax parity have been introduced this year. Finally, at the local level, localities are challenging preemption clauses that prevent them from enacting more stringent tobacco control measures than state law. It's against this backdrop that today's panel will discuss how harm reduction can be applied to tobacco control policy. Now I'd like to introduce you to our panelists. Dr. Michael F. Pesco is a health economist and an associate professor in the Department of Economics at Georgia State University. He's also a research fellow with the Institute of Labor Economics. Dr. Pesco's research uses retrospectively collected data and quasi-experimental methods to evaluate health policy changes. Dr. Pesco is particularly interested in policy changes affecting the use of e-cigarettes. He has published more than 50 peer-reviewed papers in top health economics, health policy, and labor economics journals. His research has been supported by externally generated funds exceeding $4.5 million since 2016, including from the National Institutes of Health and the American Cancer Society. Dr. Pesco is also a member of the Canadian Scientific Advisory Board on vaping products. Helen Redmond is our second panelist, and she is a senior editor of Filter, an online publication whose mission is to advocate for rational and compassionate approaches to drug use, drug policy, and human rights through journalism. She has written about nicotine, mental health, and drug policy for publications including Al Jazeera, Alternet, Harper's, and The Influence. She is a licensed clinical social worker. She works with drug users in medical and community mental health settings. An expert in tobacco harm reduction, she provides training and consultation on mental health, nicotine use, and tobacco harm reduction. And in 2016, organized the first tobacco harm reduction conference in the United States. Helen is also a documentary filmmaker. And our third panelist is Dr. Pritika C. Kumar, and she is a senior fellow in R Street's Integrated Harm Reduction Program. She has experience in areas spanning from sexual and reproductive health to mental health, and from infectious diseases to substance use. She's worked in multilateral organizations such as the United Nations and the World Bank, engaged in for-profit and not-for-profit sectors, been involved in integrated health systems, and conducted academic research. Within the broader context of harm reduction, Pritika's research interests include social determinants of health, social norms, social capital, social networks, health disparities, and equitable access. Her doctoral and postdoctoral work focused on the role of social capital in harm reduction from a social networks perspective. So we're going to jump right into questions. And my first question is for Helen, and that is, what does it mean to reduce harm from tobacco?
It means saving the lives of millions of people around the world. Just to put it simply, we have a series of revolutionary technologies, in particular vaping devices, that can dramatically reduce the harms of smoking. So we are in a position, and we have been for many years now. I often say like this new revolutionary technology, but actually it's been around for over a decade, right? We have the ability to reduce the harms of tobacco use in a way we never have. And it's incredibly exciting. And I'm optimistic, despite the fact, at least in the US, we're in a very difficult situation where there's a massive backlash against vaping and nicotine use. So we have the tools to reduce harms from tobacco. And it's an amazing thing because for a very long time, it was really hard to do that. People weren't switching, in particular the vulnerable populations that I work with, people who use drugs, people who are homeless, and people with mental health issues. It was very, very difficult. The traditional NRTs just don't work. The efficacy is not there. So we can reduce the harms of tobacco use, and that is an amazing thing.
Absolutely. That's why we're here today, to teach people a little bit more about how we can reduce the harms from tobacco. So I'm going to go around to all three panelists for this question, and we'll start with Dr. Pesco. Why is it important to view tobacco control from a harm reduction lens?
Well, I guess one way that you might think about it is you might ask, well, where does demand for nicotine come from, right? And I think you could hear a lot of different answers to that question, right? Some share of nicotine demand it probably does come from industry activities related to, targeting youth, related to price discounting, related to aggressive advertising, that kind of thing, right? But we also know, from history, right? I like to think about cigarette consumption in the old Soviet Union, actually, right? And in that particular context, advertising was banned. There weren't differentiated products. They were all the same price, right? And there still was a lot of, even though there wasn't really industry activity, there still was a lot of demand for cigarettes in that particular context, right? And so it might kind of force us into an uncomfortable thought process that maybe some amount or a sizable amount of the nicotine demand that we observe is demand from the people themselves and isn't imposed on them by industry, right? And they have a demand for nicotine products, right? And so that's a kind of an undesirable human quality. We would prefer people not to have this demand for nicotine, but if they have it, at least we should satiate it in a way that makes it less likely to kill them, right? And I think that's where the role for harm reduction comes in. And if we believe that there is a sizable portion of the demand for tobacco that is coming from within people themselves and is not imposed on them by industry, then suddenly the only real option we have in that case is to try to come up with reduced harm products that make it less likely that people die.
Thank you. Pritika, would you like to ring in next?
Yeah, sure. Thanks for the question, Chelsea. I think before I dive into answering your question, I want to just present some numbers. So the number of adult smokers has declined significantly over the years. In fact, we're at an all-time low of about 14% adult smokers in the country, but that still translates to about 34 million adult smokers who smoke combustible tobacco products that add significantly to the burden of disease and death. And cigarettes remain the most commonly used tobacco product till date. Another important statistic to share here is that according to the survey data from the National Household Interview Survey, about 68% of adult smokers said that they wanted to quit smoking. And about 55% attempted quitting in the past year. But guess how many were able to successfully quit? Only about 4 to 7%. So with that statistic in mind, harm reduction being a pragmatic approach which lies on the foundation of compassion, non-judgment, meeting people where they are, remains a very effective tool. It is not the answer, but I would say that it's a complementary approach alongside with some tried and true to evidence prevention and cessation strategies. As someone with a mental health background, I believe that offering people choices and meeting them where they are is a much more effective strategy than pushing them into a cycle of shame and stigma for not being able to achieve that gold standard of zero use. And historically, we have seen successful examples of harm reduction, whether it is needle exchange to minimize the spread of HIV/AIDS, sex education for adolescents, methadone as a substitute for heroin, motorcycle helmet laws to prevent severity of head injuries. And I have to say that all of these were faced with fervent public opposition, with a strong underlying tone of moralism. Nevertheless, public health, which is now unfortunately a segment of public health, is so opposed to smoking harm reduction, tobacco harm reduction. Public health has embraced these strategies in the past based on a pragmatic approach of what works. So I don't see a justifiable reason why smoking harm reduction should not be brought into the fold of this framework of thinking. Thank you.
Thank you. Yes, thanks for all of those other examples of harm reduction. For anyone who tuned in to our first of this series, you heard a lot about some of those other methods of harm reduction. And Helen, why do you think it's important that we look at tobacco control from a harm reduction lens?
I think it's important because if you're not in the tobacco harm reduction camp, you're probably in the abstinence camp, and you're probably supporting some kind of ban or prohibition. And that doesn't work. And then if you don't accept tobacco harm reduction, you are lost. You essentially have nothing really to say to smokers except quit. And we know, Pritika just gave that statistic of the amount of people who want to quit and could not quit. So we've got a group of people in the United States, this is probably true in most countries in the world, that continue to have high rates of smoke. We have a group of people for which this kind of quit or die message has not worked. They're not listening to it. So the harm reduction lens is really, really important. It's a recognition that nicotine is here to stay. Smoking is actually pleasurable. I know we're not supposed to say that, but I'm going to say it. And I'm not even a smoker. Smoking is pleasurable for a lot of people. And with harm reduction, people can continue to use nicotine and have those pleasurable aspects, the hand to mouth, the inhalation, the exhalation. And so that's what tobacco harm reduction is about. It's a recognition, nicotine's here to stay. We have a way to dramatically lower the harms of it. So there's all that. And then also for me, tobacco harm reduction and just harm reduction, the philosophy is about people who use drugs themselves and really listening to the experiences of people who use nicotine and have smoked. And I feel that is so missing for people who are about abstinence and prohibition. They're not listening to the people who are using nicotine, whether it's through vaping or snus, or it's people who are still smoking. And part of it is public health and tobacco control organizations have so stigmatized smokers, prejudice, I would say hatred actually of smokers, the shaming, the blaming. And again, it goes along with the abstinence and the banning. You're bad. And harm reduction is a rejection of all of that. And I really liked what Pritika said. It's about being non-judgmental, empathic, and giving people the tools to choose how they want to quit. There isn't just one way, right? Has anybody here ever tried to eat healthier, right? You need some tools to do that. It isn't just one way to get to that. And it's the same thing with tobacco harm reduction. So if you're not using the lens of tobacco harm reduction, you're lost. And you don't really have anything to say to the 34 million smokers in the United States.
Thank you so much for that. I'm going to move on to the next question, and that is for Pritika. Could you briefly let us know what the safety profile of reduced risk tobacco products is compared to combustible cigarettes?
Yes, there is a harm minimization continuum, which is now more popularly known as the risk continuum. In fact, for this, I'd love to share my screen and show this one figure that will help me, highlight my point. So give me 1 second. I know this worked earlier, so it should work now. Can you see my screen? Okay. All right, great. Thanks, Chelsea. So there is a harm minimization continuum, which is also known as risk continuum now, when it comes to assessing the extent of harms caused by a range of tobacco products. Now, I'm going to quote Dr. David Nutt's research, which he did along with a few other researchers, and it was an international expert panel that was convened by the Independent Scientific Committee on Drugs. Now, they developed a multi-criteria decision analysis model of relative importance of different types of harm related to the use of nicotine-containing products. Now, in this, how they defined, they took 12 different products containing nicotine, and they used a 14 harm criteria. So, 7 criteria were associated or represented the harms to the user, and 7 represented harms indicated harms to others. So the products along the harm minimization continuum, the foundation of this thinking is that all, or not thinking, but it's researched, all nicotine containing products are not equally harmful. And instead, they range from exceptionally low harm. For example, the patch, oral products, nasal sprays, those represent the NRTs, also known as the nicotine replacement therapies, to exceptionally high harm, for example, combusted tobacco products, such as cigarettes, small cigars, pipes. You can see them in extreme right in the combusted tobacco panel. Now, this figure, it depicts 4 panels representing classes of products, and the products containing tobacco are in the panel 1, which is extreme right, the combusted or smoked products. And then the right middle is the non-combusted or smokeless. Now, smokeless products are far less harmful than smoked tobacco, but there is a variation in that smokeless tobacco category as well. And that is, for example, you will see the low nitrosamine containing products like Swedish type snus is lower in harm relative to the harm that is from unrefined smokeless tobacco. Heat not burned tobacco products, for example, heat sticks, they fall into this panel too. And then in the left middle panel is the class of nicotine delivery products that do not have tobacco, but can contain nicotine. And that would be e-cigarettes, vapes, and the NRTs that I talked about earlier. So you can see that, one thing to note here is that e-cigarettes are not completely safe, or even the safest nicotine containing product available, but they are much safer. When you see the combusted products on the extreme right, and when you come down to smokeless tobacco, that is a very steep decline in harm from the combusted product to the smokeless product, and that is known as the risk cliff as well. So the NRTs are safe enough that the Center for Drug Evaluation Research at FDA have approved them for over-the-counter use, while and also in 2013 they labeled the NRTs that they're permitting their use while smoking, also known as dual use, as a part of the journey to cessation, and it permits the sustained use for relapse prevention for a lifetime if need be. But at this time, I want to also add one more layer to this conversation. And I know this was tricky last time too. Let me just try and, okay. So this model was given by David Abrams and colleagues. David Abrams is one of the leading tobacco researchers. Now, in this one model, they added a third dimension of appeal. which I feel is a very important dimension when you're considering harm reduction. And so NRT products, while they are minimally harmful, you can get them over the counter at a pharmacy. They are minimally harmful and dependence inducing. There is a lack of widespread appeal among among smokers for NRTs. NRTs have demonstrated a weak ability to displace cigarettes, despite CEDAR's approval as a cessation therapy. So in contrast with NRTs, some innovations like e-cigarettes have actually begun to occupy that sweet spot that you see on the top left corner in that three-dimensional space, because some smokers have found e-cigarettes with sufficient appeal for them to sustain use and quit smoking. So I feel like, a lot of times we are stuck in that two-dimension of risk continuum, but we miss out on why appeal is an important dimension when we are looking at safety as well.
That is so true. And actually that kind of leads into the next question that I have for Helen, which is, can you talk a little bit about how people use reduced risk products to transition away from combustible products?
Yeah, we're using the word journey a lot now. I think at some point maybe we have to find a new word, but there is what we call the journey from smoking to vaping. And it's different for everybody, but from doing interviews with people around the country and then doing tobacco harm reduction vaping groups with people who use drugs and are marginally housed and have mental health issues, there are some common things that we see when a person tries to make a switch, and just understanding how change happens, right? And first of all, people have to have access to products, and they have to be, as just mentioned, they have to be satisfying. And so it starts out with people have to try these products. And so the minute somebody says they want to vape, that's a win right there. They want to try to change. And so people start vaping and they need to try typically a couple different vaping products. They might throw in snus and see if that works. So, it takes time, and it takes trying different products, different strengths of nicotine. People self-titrate nicotine, and people know when they've had enough. But you might not find that out with the first device that you use. So you're trying to figure that out. And depending on the device you use, there's some work involved. I mean, there's nothing easier than lighting a cigarette, right? I mean, that's one of the things that's so compelling about smoking is you light it and within 8 seconds, bam, you get that hit of nicotine. So we have to have that available for some people who need that right away, and they need that throat hit. So people are trying different products, and dual use was mentioned, and dual use is completely normal and natural, and that is people still smoke cigarettes and they're vaping, or they're using another safer nicotine product. That is completely normal and natural. Whenever you're trying to change your behavior, whether it's moving to a safer nicotine product or eating healthier, you don't stop eating fast food, right? The day you say, I'm going to eat better, right? Or if you say, I'm going to eat less meat to be healthier, you don't do that. So we have to understand that. Unfortunately, the anti-vapors have seized on this dual use and said, see, people can't use them to quit. But the idea is if a person's smoking and they're vaping, the idea is to keep moving down that continuum until they are 100% on the vaping. And again, it takes people different amounts of time. I have a friend in California. It took her a couple of years. She smoked a couple cigarettes a day and she started vaping, and slowly, but over a couple of years, then she was able, now she vapes 100% of the time. There's other people that I've interviewed, it just took a couple times and they were able to. But I want to note here, because of the kind of backlash around dual use and the profound misunderstanding of how people change. Stanton Glantz has blogged about this, dual use, it's really bad. Some researchers in South Korea have said if you're dual using, you're raising your risk for all kinds of things. Well, guess what? With the other NRTs, the patches and the gums, they actually tell people, don't stop using the patch if you're smoking. That's dual use. If you've got a patch on, you're still smoking cigarettes, that's dual use. In fact, they tell people, I just did a quick Google search earlier today to just verify that I was right. They actually tell people to use the patches and the gums, use them together, double up so that you don't smoke. That's dual use, but nobody's looking at that and saying that's really problematic. So we need to reassure smokers, because smokers, people have had relationships with cigarettes for decades. You think somebody is just going to say goodbye in one day? I mean, I know there's examples, I'm happy for you, but in my experience, it just takes longer. And let me just add, we're in an environment right now that makes it a hell of a lot harder to quit and to move to vaping. And that's because of the attack on vaping. So we have a situation now where in some states you can't get vapes through the mail. Right, they shut that down. You can't get flavor bans. They're shutting that down. Online sales prohibition, shutting that down. Exaggerating the risks, the media campaigns. So we've created an environment for people who want to switch, and it's really so much harder, right? So we can't blame those folks for not switching. We have to look at what we're doing to enable people to switch. We're doing the opposite. And of course, when you do that, when you do all of these things to make vaping harder, you're leaving cigarettes as the easiest thing for people to get, because you're not going after the most dangerous nicotine delivery device. And if you look at England, they're doing the opposite. They're doing a study right now with people who are unhoused. They're giving them a free starter kit. They're making it easy for people to try these products and switch. We're doing the opposite in the United States. So don't blame those smokers when they're not transitioning. We are making it harder for them to do that.
I think so much of that rings true. And we're going to talk about some of those policies actually in a few moments. But first, I want to talk about a policy that was enacted in December of 2019, which is when the federal government raised the minimum age of sale for tobacco products to 21 from 18. And this question is for Michael. What, if any, impact has the legislation had on youth use?
We've documented sizable declines in youth tobacco product use. I've personally been kind of surprised by the magnitudes of the declines. There's another kind of research group they've looked within the youth risk behavior surveillance system. They've documented large declines among not just 18 to 20-year-olds, but also among some younger ages as well. Me and my colleagues have been looking within the Monitoring the Future survey data to document similar rates of decline. And this is across all tobacco products as well, although the more sizable decreases, I believe, are coming from the e-cigarette use as kind of a percent of the baseline mean. One kind of interesting piece of that legislation is if you look at kind of perceptions of the risk of different products and how those change in response to Tobacco 21, we actually see, because the e-cigarettes are included within T21, individuals, youth may not have the same solidity of their ideas regarding the risks of e-cigarettes as they do cigarettes. And so T21 seems to really increase their perceptions of the risks of e-cigarettes. So I have suggested an alternative approach. Maybe we should be considering a combustible 21 law. Not in the United States, we have tobacco 21 is here to stay, but for other countries considering raising their minimum legal purchase age laws, they might consider a combustible 21 age law as a way to try to reset some of the risk perceptions of people overshooting in their perceived risks of e-cigarettes versus cigarettes.
Thanks. And you kind of touched on this, but do you have any suggestions on how we can keep e-cigarettes on the market, but also see reductions in youth use, in addition to you said T21 was effective, but do you have any other comments on that?
Well, I mean, it's a tough policy. It's hard to thread the needle, basically, right? And find a regulation that only affects, youth, and it doesn't affect adults. I mean, tobacco 21, that seems about as close as you can get to trying to thread that needle, right? I mean, I've long been concerned about how easy it is for youth to access tobacco in retail environments. And this is especially true for cigarettes. About 50% of youth get cigarettes in retail environments, and monitoring the future data. Only about 10% of kids report their usual source of e-cigarettes being from a retail environments. But if we had, a more kind of rigorous compliance inspection program, if governments kind of took it more seriously, I could imagine that, really shifting the culture around not selling tobacco to kids. And I think that there's pockets of industry that continue to do so and that profit from it because the penalties are just too low and the compliance inspections are just too irregular. And it's too easy, honestly, to identify the inspectors when they come into the store. They're not allowed to lie about their age in many cases. They can't use fake identification. So if there were ways to improve that program, I think that would help reduce tobacco use across all products, right? Cigarettes, e-cigarettes, et cetera. And so that's, that would be an area where I would recommend focusing on. I know that there are some states now, they do have laws requiring ID scanning to purchase e-cigarettes. So that seems like an innovative a solution to this problem, right? And in need of evaluation to determine, is this an effective approach? And so, the researcher in me, I get excited when I see a few states adopting these policies, because now that's something we can actually analyze, right? And so I know that within some of the anti-tobacco groups, they say, well, we don't have the evidence to support these policies. Well, great. So let's try it on a trial basis in a few states. That's the beauty of America, right? And that we can get policies enacted in some places so that we can study them to learn if this could be a possible approach going forward. So those would all be ideas that I have on that question.
That's so true, is that the compliance piece is a huge component of any policy that you put into place, and sometimes that is lacking. Helen, can you talk a little bit about flavored reduced risk products and how they can help smokers switch from combustible products?
Yeah, I'm all in for flavor. Human beings love flavors. It's part of and the enjoyment of life. And we know that when people make this transition, flavors play a key role. Something like 90% of people who end up switching from combustible tobacco to a vaping product, whether it's a mod or a disposable, flavors were key in that. And there's a psychological component to it. And people who made the switch tell us this all the time. They want to break away from the tobacco flavor because that's what they had been doing. And it can be very triggering. So if you have a flavor, that interferes with that. And so I want to just read this Twitter post by the Pirate. He owns a vape shop in the Upper Peninsula of Michigan, and he's helped hundreds of people transition. And this was a tweet actually today. And this is what he said about flavors. Helped transition 2 more new quitters today. 64-year-old, just out of the hospital for a heart condition, with 6 milligrams vanilla cannoli. It sounds awesome, vanilla cannoli flavor. And a younger guy, with 30 milligrams vanilla almond custard. Both thought they needed fruity flavors. Flavors and flavor variety are imperative for cessation. So we know this, and the more flavors you have that people can choose from is better. But again, we're in a situation where flavors have been the main targets of bans, and that people know this wrong idea that there are kid-friendly flavors, and it's the flavors that are getting teenagers to like these products. We know from several surveys that is not the number one reason why young people try electronic cigarettes. It's not the number one reason. It's because their friends are doing it. And then later down in the questions, they'll talk about flavors. But even if it was number one, I don't care, because the flavors are helping people transition. And that is about reducing morbidity and mortality. It's about living, and it's about having less disabilities related to smoking. So that's what the flavors are all about.
I know that I like a flavored everything, but the next question is for Michael, and it is, when considering taxation of reduced risk products, what should policymakers be aware of?
Well, I think they should be aware of me and my team's research. For one, we find that e-cigarette taxes reduce e-cigarette use, sure, but at a pretty sizable expense of sizable increases in combustible use. So we document this for kids. We document it for pregnant women. We document it for adults. We document it within sales data. And more recently, across a variety of different data sources, we're showing it particularly strong effects within the young adult kind of college age population. So that seems like a very a blunt instrument that likely is going to do more harm than good by pushing a sizable share of these people that do quit from e-cigarettes into using a combustible tobacco product. So, I mean, economists, we believe there's a role for taxation. Certainly, I'm not anti-tax. We believe that if there's externalities or any kind of market failure in the economy where people don't have accurate risk information about risks, or people are imposing costs on others, that is economic justification for a tax. Now, the case of externalities or imperfect information is a lot smaller for e-cigarettes than it is for cigarettes, right? Because of the reduced risks of e-cigarettes. And so I think the optimal policy then is some kind of small tax on e-cigarettes relative to the cigarette tax. And then instead of focusing on e-cigarette taxes, which, by the way, don't really raise any revenue for states, why don't we just increase cigarette taxes more to widen that price differential between cigarettes and e-cigarettes, and encourage even more people to choose the healthier option. And I would just add that, we show this within kids too. So I think a lot of people say, well, e-cigarette taxes, they're there to protect kids, but we don't find evidence of that unless we are trying to encourage kids to smoke cigarettes, which I don't think is anybody's goal.
Thank you so much for that. We talk a lot about risk proportionate legislation in taxation and in other areas at our street. And I'm going to do a shameless plug. There is a little explainer about risk proportionate regulation on our website that you can go look for if you're looking for more info. So this is going to go around to all of our panelists. What can policymakers do to ensure that tobacco control policies incorporate harm reduction? We'll start with Kritika.
We must make room for science to inform policy. That's how I'll start. And I will say that there is a need for science-based reframing of nicotine use. to reform the current and future tobacco control strategies. Science has generated enough and very credible evidence, like what I showed you, but this was research done by independent academic researchers, not funded by industry, that non-combustible tobaccos are significantly less harmful compared to combustible tobacco, where the most harm comes from. I do share concerns about youth vaping, but vigilant, prudent policies and enforcement of policies is what we need, and not an exaggeration of the harm of nicotine. I feel that when there is a selectively exaggerated fear around nicotine that needs to be questioned, and it's actually going to do more harm than good for population health. Policies that are designed to crack down on e-cigarettes will further prevent us from decoupling nicotine from the real cause of harm, which is combustible tobacco use. And lastly, based on David Abrams' model that I showed you earlier, flavors, like what Helen said earlier, flavors play a key role in that transition, or in that switching from combustible tobacco use to non-combustible use. Appealing flavors, we need more efficient nicotine delivery systems and lower cost compared to cigarettes. All of these play important roles in improving the overall appeal of non-combustible reduced risk products on a large scale. And smokers who have completely switched to e-cigarettes have said it in multiple studies that it is the flavors that have helped them to switch from combustible tobacco to non-combustible.
Thank you. Helen, do you want to take a stab at that question?
Yeah, I think that we have to educate this group. We have to educate them to the truth, because unfortunately they are believing a lot of the junk science, and there's so much of it. They're believing the tobacco control organizations when they say there is a teen epidemic of vaping. There never has been. And we've seen the numbers go through the floor in terms of vaping, right? And smoking cigarettes. I mean, it's historic, actually. So there has to be a lot of education for the people who are making a policy. But I also feel like we have to put pressure on them, and we have to protest them, because if you look at most harm reduction interventions, there's been a fight around it. Now, it's not a fight we want to have. I mean, I wish that we could just convince policymakers with the evidence we have now, we should be able to, right? 95% safer. Vapes double your chances of stopping smoking. Researchers in Italy have found harm reversal, right, for people who have asthma and hypertension, right? So the science is there, and that's important, but that's not always enough to move policymakers, especially because we're still in a drug panic around nicotine. So pressure has to be put, protest has to be put on them, and we have to find a way to shift the focus from teenagers, who, by the way, I'm not that concerned about them vaping. I'm not. I mean, compare that to if they're going to use fentanyl. No. I'm all for the vaping, okay? We have to put the focus on the groups that have the highest rates of smoking and morbidity and mortality. Hello? What we're doing isn't working, and we're not talking about that. It's so frustrating for me that you don't see in the national media. Why is it that people who have the diagnosis of schizophrenia smoke at such high rates and die something like, on average, 25 years earlier than those who don't have that diagnosis? Why aren't we talking about that? People who are homeless, people who use drugs. Why aren't we shifting? And then adults who aren't in any of those categories, right? Why aren't we so shifting the narrative to the people who have the highest rates of smoking. And what are we going to do? We're so far behind in terms of reaching out to these populations and helping them make the transition, whether it's to vaping or to snus, and so far behind compared to countries like England or even New Zealand. So that's what I want to do: educate, pressure, protest, and force them somehow to shift all of this energy they're putting into teenagers and put it into the people who have the highest rates of smoking, because we are optimistic now that we can help groups that have numerous challenges, right, to making change. I mean, imagine living on the street, being a heavy smoker and changing that behavior, right? We've got to focus on those groups. So that's what I'm recommending.
Thank you. I think you're really talking about hitting on how harm reduction is compassionate and how we need to be aware of that compassion for a lot of the people who use tobacco products. And Michael, what do you think that policymakers should do to ensure that harm reduction is incorporated in policies?
Well, I mean, regulate proportionate to risk. I mean, that's, across the spectrum. I mean, taxes is pretty easy to think about that one, right? Because you have a nice continuous, a way that you can set different tax rates proportionate, right? It's harder to think about it in the context of minimum legal purchase age laws, flavor bans, but having at least some flavors that are in e-cigarettes that aren't in cigarettes seems like one way to hit that kind of principle. I guess I consider, I kind of am approaching it a little bit different than Helen, especially being kind of more of a scientist. I guess my goal, and I hope other scientists' goal, is to just as these policies get adopted, right, to quantify, well, what impacts does it have on is it complement substitutionary kind of behavior, right? Let's take advantage of early laws that are enacted at the local or state level, and so that we can learn something about what impact these policies have, so that we warn future legislators about what unintended things that they might not be aware of, and also so that they know about whether the policy worked as intended or not. But one thing that I am kind of worried about as a scientist, again, is that I think was alluded to by the other panelists, was just kind of health misinformation out there and bad science that's out there, right? I think that's a big problem. And I think if you look at, like the 2016 Surgeon General report, I mean, there were all kinds of just scientifically concerning conclusions that were raised in that report, right? And so how do we hold the report writers accountable, right? And how do we make it such that bad reports are not generated in the future? I think that's kind of a conversation we need to have as scientists, and determine ways forward, so that we don't continue. We have a history of the CDC, the Surgeon General, basically contributing health misinformation in this space, right? And getting them to change the name E-Valley, getting them to change their conclusion about the impact that e-cigarettes have on cigarette use, despite cigarette use among kids now being basically virtually non-existent, right? It certainly doesn't seem to be a gateway like they said in 2016, right? Changing the culture around how these reports are generated, I think that's a conversation we need to have as scientists that I think will help to create better policies further down the road then.
Thank you. Yeah, I really like what you had to say about evaluation and evaluating the policies. And I mean, I think that something that policymakers can look at after that is how they can reassess policies that they may have put into place if they find that, or if evaluation finds that they were maybe not as working as intended. And my last question for the day is for everyone. And if attendees only take one thing away from this event, what would you want them to know about tobacco harm reduction? Helen, what would you like to add?
Dare I say, I'm going to add two, but they're really quick. One is, if you're a smoker, try to make the switch, because you have a much higher chance to actually leave combustible tobacco behind if you start vaping. So if you're a smoker, try to make the switch. The second is if you vape, you need to be an activist, and you should think about joining consumer advocates for smoke-free alternatives, CASA. You should think about joining New Nicotine Alliance, INCO International network of organizations. Become an activist, because that is a critical component of this fight. Michael, I agree with you. The science is super important, but without some kind of pressure to do the right thing, it's so easy to just keep on doing what they're doing right now. So become an activist.
And Pritika, what would you like to add for our attendees to take away today? And also, if anyone has any questions, we have a few minutes left. Go ahead and put them in the chat, and we'll potentially get to them.
I loved both Michael and Helen's points. And one thing I do want to highlight here, and something that is not often talked about, is the huge amounts of disparities that exist in tobacco use. This is data that is on CDC's website. While the cigarette smoking rates have declined significantly, cigarette smoking is prevalent much higher in certain subgroups, like, for example, people living with mental illness, living with HIV, disability, adult smokers with annual income of less than $35,000, psychological stress. I mean, so prevalence of cigarette smoking is way higher in these subgroups. I may have left out a few, but these are one of the, even people with racial and sexual minorities. So harm reduction lets us use that approach where one size does not fit all. Quitting is not everybody's goal. It may be the gold standard for some, but it is not for many of the adult smokers. And so, so we need to use a health equity lens when we come to, when we look at harm reduction, using health equity lens, looking at making sure that these regulated reduced risk products are available to adult smokers, are accessible, and they're affordable. And then I know you asked for one, but I will add quickly one thing that is super urgent, is that we bring folks such as harm reduction coalitions, healthcare providers, social workers, mental health care providers, dentists, along with people who have lived experiences of having smoked, like myself, and have struggled with quitting and have quit or are unable to quit. Just like Helen said, we need to bring in people who are consumers on the table, along with all the other healthcare providers and social workers on the table, to come to a mutual understanding of what do we mean by harm reduction. So far, the voices that we hear are public health and industry, but it is crucial that we include these other voices.
Thank you all so much for your insight and sharing your expertise with us today. I see no questions, so I am going to give everyone back about 5 minutes of their day. But thank you again, and everyone, please have a wonderful rest of your day.
Thank you.
Thank you.
Thanks, everyone.